Hey, you guys, I'm so excited. I heard back from so many of you guys, and you wanted to learn about the thyroid labs. You want to learn more than just, hey, how's my thyroid functioning and do I need medication, right? I want to share with you why this is so important to me, why I have such a passion around this. I was basically misdiagnosed for years, years and years. At least 8 years of complaining of chronic fatigue, being told I have anxiety, depression, fibromyalgia, chronic fatigue, you name it, I had it, but nobody checked my thyroid. I even had a nurse practitioner tell me that I had a large Adam's apple. Mind you, I'm a female and females don't have Adam's apple, and there was no confusion about that. She'd done a pap smear on me, so she knew I was a female, but she didn't check my thyroid. Why was that being missed? I don't get it. I was a classic symptom patient, young female, complaining of all of these symptoms. And it wasn't until years later that I incidentally got checked because I had had an injury that resulted in me getting an MRI of my neck that resulted in the radiology tech picking it up. And lo and behold, I was then finally diagnosed with hypothyroidism. Still didn't know I had Hashimoto's thyroiditis, still didn't know I had an autoimmune disease. Eventually, at one point, my ENT did mention that it was Hashimoto's thyroiditis, but I didn't know what that meant. I wasn't even in the medical field. I mean, I had just become a new graduate RN all these years later when I was diagnosed with hypothyroidism for the first time. That was about an 8 year span between me complaining and finally getting diagnosed with hypothyroid. But still, no one told me that I was at increased risk of developing a thyroid cancer as a result of this. I would ask them, like, how can I heal my thyroid? What can I do? Nobody had any advice for me. Here, just take your thyroid hormone. Here, now that you have thyroid cancer, just get your thyroid removed. No big deal. Get radiation. No big deal, right? I mean, that's what I was basically what was pushed on me. And in their defense, I don't think they had any other ideas. I don't think they knew any other suggestions. They were just giving me the information that they had. Um, no one had really communicated to me how autoimmune disease means it's a misfiring of your immune system. It's attacking your own cells. And if it's attacking the thyroid cells, it could attack any of my other cells too. So it could get into my gut or my lungs or my skin or somewhere else. Nobody told me that. If you have one autoimmune disease, you're at more increased risk of other autoimmune diseases. Or if your immune system's so busy attacking itself, guess what it's not attacking? The bad cells that could be the chronic infections, it could be the cells that are turning into cancer. It's not attacking those. I didn't know I was at increased risk for cancer just because I had hypothyroidism. No clue. Um, so all of these things went missed. I didn't know that my environment had anything to do with it. Chronic infection, which I did have, I didn't know that had anything to do with it. Didn't know my lifestyle had anything to do with it. I was clueless. Even though I'd gone to school at that point to become a registered nurse, went on to get 3 more additional degrees. I'm at the top of my field now and with a doctorate degree in nursing and have practiced as a primary care provider for years. And I was just as clueless as everyone else. I told my patients the same thing, didn't have any answers for them. And so even though I empathized, I didn't know what to suggest. In recent years, though, I have just been immersing myself in trying to understand, like, what can we do about this stuff? Partly because of my own health problems, partly because of health problems of my family members. And I have really stumbled upon some great information that I feel has certainly helped me reverse some of my other autoimmune issues that I have been suffering from, as well as helping my daughter take care of several of her autoimmune issues that she was suffering from as well. So the way I think about it is the thyroid is like a canary in a coal mine. So if you're not familiar with the canary in the coal miners used to take canaries down into the mines with them because they were more susceptible to the carbon monoxide poisoning. So when they started to show symptoms or they dropped dead, the miners knew it's time to get out of there so they can get some fresh air so that they didn't drop dead. And so while all of our bodies act similarly, we also have a lot of differences with the genes that we're born with and the environments that we live in, the toxins we're exposed to, how our bodies respond to toxins that we're exposed to, stressors and our response to those stressors. And the way that our body then responds is how our epigenetics work. And so if we are doing things that are healthy for us, it upregulates the healthy expression of the genes that we have. And if we're doing things that are unhealthy for us, it downregulates the healthy genes and upregulates the unhealthy genes so that they express in the form of symptoms or dis-ease, meaning being ill at ease, having a lack of ease, and eventually disease. And so we don't want any of that to be happening. And there's a lot of answers, but we are bombarded with toxins, we're bombarded with exposure to pathogens. And so I want to create this series for you guys. I think it's going to make a big difference in your lives. Who is this series for? It's anyone who's got any of these symptoms, the chronic fatigue, gut issues, chronic pain, hair loss, dry hair, dry or oily skin, acne, unexplained rashes, anxiety, depression, heart palpitation, chronic infections like Lyme disease, Epstein-Barr, and on and on. If you've got a chronic infection, trust me, you know about it. Anyone with a diagnosis of thyroid issues like hyper or hypothyroid, typically they're autoimmune in nature. More commonly, they're Hashimoto's thyroiditis or Graves' disease, even though, of course, there are other causes. Those are the most common causes. You actually can have both at the same time. They're both autoimmune in nature, and it's just a different way that your thyroid is expressing that autoimmune response. And it's for anyone with an autoimmune disease of any kind, because if you have one autoimmune disease, like I said, you're at increased risk for other autoimmune diseases. And so, of course, if you have a family member with any of those symptoms, you're definitely going to want to watch this. And anyone who wants to optimize their health and catch some of these early warning signs that could show up in their labs. So this is the first video of a multi-part series. And so the next video, we're going to be talking about basic anatomy and physiology of the thyroid. And further on into the series, we'll talk about what labs are important and what are usually covered by insurance. No guarantee there, of course, but they've been covered under my insurance, under my mother's insurance, several friends of mine and people that I know, clients that I have. So I know it's usually covered, but like I said, no guarantee. Labs that you may want to request that your doctor order in case they're not ordering a full panel, as well as what most traditionally trained medical providers understand about the labs, because that's kind of the beginning point. You're going to want to know that information, but then also what additional information can we infer from the labs if perhaps your doctor doesn't know about it. It could even be an opportunity for you to open the door to have a conversation with your doctor, to ask some more questions or enlighten them or encourage them to learn more about it like I did. And so if you have any questions during this video series, please post them below or respond to the email so that I know, because I'm building out the video series as we go, and I can answer the questions in the video series. And also let me know if you would want me to do a series on autoimmune reversal, because I think that it would blow your mind if you learned a lot of that information as well. Catch you guys later.